Well, top story in the Wall Street Journal this morning, Aetna, the latest health insurer to pull back on its Obamacare coverage, saying it will leave 11 of the 15 markets it currently operates in. John Hilsenrath has been looking at this story for us this morning, and this is in the latest string of companies to make this move. There seems to be a bit of an exodus.
A bit of an exodus. Aetna is moving from 778 counties where it sells plans to 242.
Wow.
So the problem here is that they can't make money on the people who are enrolled in the plans. You tend to get sicker people enrolling in these healthcare plans, and they're losing piles of money on it, and they're getting out. So the question is, where do you go from here? There are a lot of counties. We detail counties in this story that are going to have no insurers on their plans. You end up forcing people into government-covered plans.
Yeah, and then what happens then?
It's incredibly sad. I mean, when you think about people's lives, you try to create a policy, when they tried to create the Affordable Care Act and something that would insure millions of people, I mean, you're giving them no options. I mean, no insurers in one county. I mean, think about what that means in someone's everyday life. I mean, they have no options.
Well, the conspiracy theory is that the Obamacare plan was designed to not work, to fail.
So it would eventually be not socialized medicine, but Medicare for all.
I think that's giving Congress a little bit too much credit. I think what actually happened is they created this Rube Goldberg program that just doesn't work when you put all the pieces together.
But it raises issues because in the Journal article, there's one county in Arizona, potentially Pinellas County, that won't have any insurers on the exchanges. But you're supposed to buy your insurance on the exchanges if you want the subsidy from the government. So where does that leave them?
Well, for people with low income, it leaves them on Medicaid. It forces people into Medicaid, and for people who have the income, it forces them into plans that have much higher premiums.
Right. And I want to talk about the markets quickly.
Or I should say, with no insurance coverage at all.
I just want to add to my conspiracy theory that this is going to lead to single payer for all. Hillary Clinton and President Obama have both mentioned that they want a public option for the Affordable Care Act in order to pick up the slack. That means that the government would insure them in the way that Medicare works. Well, so it would be an option, but they both proposed that.
This is an example of why this election matters so much. We spend so much time talking about how dismal the options are, but the election is going to decide which way this program goes.
But has Donald Trump said anything about health care? I mean, has he really proposed anything other than repeal? I mean, so what do we replace that with? What has he offered in that respect? I think if he gave an option on that, I mean, that would be amazing. Yeah.